So, as you maybe remember, the main topic in the morning was how to become aware of yourself, how to know yourself, and I gave you several examples of this principle, like Eigen-blood therapy or Eigen-Urine therapy, or these things have been used and nobody understood why they work. Same with stem cell therapy. Really, it's the same principle, always feeding something back of your own self. This is usually only on the chemical level, because our science, our modern way of seeing the world is only about chemistry. So now we are showing for the first time something I know will be revolutionize the whole energy medicine and medicine in general, because it is something that can be understood even by physicists, and that can be measured, that can be reproduced, but it's connecting with all what was said and was done in the last 50 years under the name of bioresonance. But there were only machines that had really no energetic feedback. There were informational feedback that did a lot of good changes, but you could not measure something, so it was always considered a hocus pocus, or like a gimmick, a placebo machine, yes? Because there was nothing that could be measured. And the manufacturers, they said there is something, we cannot show it to you, but there is energy, and of course this was always the problem. Now, it's something that every day surprises me with new things, and I probably could do a whole week seminar only about this, and I'm showing you only now basically the top level of what is now possible with this new machine, and I call this the LaesEr. Why the LaesEr? It stands for live amplification. So live amplification, LA, and then energy stimulated, ES, Eigen-resonance. So you know LaesEr stands usually for what? It stands for light amplification by stimulated emission of radiation. That's kind of the short, but really, what is a laser? We create a stimulation of this laser medium, like a crystal. And by stimulating and then having a resonator, this is the cavity, it's called the cavity, it's the two mirrors on both sides of a laser, we have an Eigen-resonance. And then we get this amazing phenomena of the laser phenomena, that you have a light that goes for kilometers without deviation. It has amazing coherence. So now this is exactly what we can create here, not with a laser, but for a human being. And you will experience this. So, I promised you will be the first one, so you can try. Yes? So, yeah, you just know you don't just take off your shoes, take off your socks. That's the only thing we have to do.
Deci, așa cum ați văzut în prima parte a dimineții, principalul subiect s-a referit la...
So, now, the main, this was very long. I don't know why it was so long. Anyway. But we had, in the whole morning, we had it was all leading towards one question. There was it was said we have to listen to our heart. And I asked, how do you listen to your heart? And really, as you see, there was nobody who could give a practical answer to this. Now, this is really the tool, and you will make people, even like Vintila, who is like a very left brain, right brain person, he will listen to his heart, and he will feel it, and I can tell you, it changes me already. you can see it, maybe. I'm not sure if I'm a good example, but it will be a way for people to get more close to themselves, to have an Eigen-resonance. So what we do, we take two places on the body where we take his Eigen-frequencies. And we can use, this most simple way is to use two of those electrodes. And this is something new. This is a new fabric from Germany that is electrically conducting. It's amazing. This is all silver impregnated. So it's silver, so it's also no problem with disinfection, no problem here. So you can use this two places, or you could use another place to take the frequencies, for example, like with an electrode, the head electrode, for example. This is very different than all the other bioresonance systems where you lie on a mat and then they say they take your frequencies. It's impossible because in any an electric circuit there have to be two poles. Without two poles there is no electricity running. So if those people tell you you lie on a mat and we'll take your Eigen frequencies, it's not working. So we always need two electrodes, and you can touch it in different places, but I like to use the right and the left side, because this is really our main polarity line between right and left brain, left side of the body, right side of the body. So now what you do, first you adjust the sensitivity of the system, that you actually measure something, because imagine we are measuring something between his feet, and some people they have like a very horny feet, yes, and some others they have very good blood circulation in the feet, and others don't. So the conductivity is very different. But what we are measuring is not the conductivity. We're measuring his own voltage, the voltage that his body is creating. So it's really something on the level of electroencephalogram and electrocardiogram. Now, yes, sorry, but you're amazing. I have no idea how he memorizes this. I have no idea. I'll have to learn something. So, now, here you have basically amplification 110 and 100, and then here you have a fine regulation. So now we start with 1 and move this all the way up here, sitting down that she can record it already. So no light comes on here. Okay, now we turn it back, or we can just switch to 10. Again, there's nothing here, no light coming on. Okay, now 100. So he is not very conductive, but there's some life, still some life, you can see. And see, now he's moving forward, it goes up, yes? And so now, for people like him, there's not so much voltage. We can even go here to the diagnostic mode, yes? And again, then we have like full scale here. We can turn this down a little bit. So what you want is to have this so that the orange light just comes on. It can be a little less. It means just now we amplify his voltage that his body creates to a very, very significant amount here. Now, this is already, when you see it here a little bit closer, it's vibrating with his own frequencies. And if you put an oscilloscope, there's a contact in the back, you can put an oscilloscope, you actually see his frequencies. It's not just a gimmick of something, it's something you can see, yes? And you can even see his heartbeat. All these things you can do, electroencephalogram, everything in one system here. So now the most important thing, that you don't create a shock for him. You turn this one down to the very left. This is very important, because this is the dial which brings his voltage up to this. This is the health integrator, but you can also use the health navigator. Works the same way. I only use this because here you see the lights. This doesn't have the lights, but it works exactly the same way. This way, the health navigator is being used to amplify his own frequencies up to maximum 14 volts. So imagine what he's getting now as a feedback is maximum 14 volts. Usually with any other system, you don't feel anything of this. Like TENS devices, zappers, they usually work with 20, 30, 40, 50 volts. TENS device is not considered a TENS device below 50 volt. Like when you have like those muscle stimulators that stimulate your muscles to lose some fat when they're starting to make movement. This is all from 50 or more volts upwards. So less, you don't get any sensation, you don't get any effect. But now this is a completely different thing because it uses his own frequencies. So what we create here is a resonance effect. So with very little amplitude, with very little voltage, we can get an amazing effect. Now, I gave him the third pad, and we just put it on his chest. Again, you can apply it where maybe there's pain, or where there is some tension, or on the opposite side, because it's a compensation effect also. So this is completely open where you apply the frequencies. But one thing is important, before you give it into the hand of the client, make sure this one is all the way to the left. Because, as I say, for some people, even 5, 10 volts is so shocking, yes, because it's their own frequencies, you see, that they run away. And very important is this, when you use it, have people sign that they are not electrically oversensitive or that they don't have a pacemaker, for example. That's the only two things, or epileptic, for example. That's the only reasons I would say is let them sign some disclaimer. Because this is really a totally new level of energy medicine, yes? And you can experience this. Now, until now, we have it all the way to the left, so nothing here on the second channel. That's where he's connected now with the second channel, nothing comes out. Now I turn it up, and I just bring these frequencies over to the channel 2, but in an amplified form. Yes?
How much amplified?
It's like it depends on if he's not very conductive, so it means the 10,000 times. Yes, it's like to come to this voltage. You see, his voltage on his feet is in the range of microvolts. Microvolts. Yeah? So it's million times actually. Yes? So let's go up here, and you see now we have 1 volt. And important also that you have this in the inversion off mode. I'll talk more about this today or tomorrow. This is another big feature, but that's another topic. So version here in the off mode, and then you turn it up, and you ask, when you feel something strong, tell me. And it's a strong man like him, probably they don't say anything. At least for the beginning. That's very interesting. I'll turn it up. You tell me if there's something too strong or something. So see now it's 9 volt. No problem. See, and this is the, so now go all the way, full scale here. So now he gets 14 volts of his own frequencies. But now 14. Maybe at this point you don't feel anything.
I feel something.
Something. But I tell you, that's very important that he just feels something now. But I tell you, when in 10 minutes, he will feel something completely different. That's amazing. It's an amazing thing. I've never seen this any way different. Maybe there are some people who need a few treatments, but the main thing that you will see, well, I'll talk about this later, but now he's basically, he can just sit there. His own frequencies are fed back to his solar plexus. So now he already said reduce it a little bit. Reduce it like now, we reduced it to 9 volts. And what you will see with or everyone I know until now, and we will learn more about this, but if he is now having this feedback of his own frequency, don't talk to the person. You can talk, but he will feel annoyed. Why is he talking? It makes me nervous. I don't want to talk now. You see, because it's a Eigen feedback. Yes. So you will see this with everyone, and then this way the sensitivity gets stronger and stronger and stronger, and you can reduce the voltage even more and even more, and you will see. And I don't want to say this now. He will say what after, let's say, 15 minutes or so, what he feels. But I can almost tell you already what it is, and you will see. It's just amazing, this principle of Eigen resonance. Eigen is like a German word. Yes, it means stands for self. But if you put in Eigen frequencies in Google, for example, it's a physics term. It's a physics term, Eigen resonance, Eigen frequencies. It's the frequencies of a body or of an object that will lead to a resonance phenomenon. So everything has a resonance frequency, not one but thousands. You see, this is the idea that modern holistic practitioners have not understood. We cannot give one frequency and then means we have a resonant frequency. Everything has thousands of Eigen frequencies, it's resonant frequencies, but we have to give the whole spectrum. One frequency doesn't do it. It's much more complex, but this is giving exactly this. It's giving the Eigen frequencies. Yes.
So
yeah.
the Eigen frequency is a mixture of frequencies.
It's a mixture.
It's
whole
not
spectrum.
one frequency for a
No.
moment, but it's a mixture of frequencies.
No, because this whole idea that something has one frequency is.
No, I mean it may the one frequency might be for a fraction of a second, but the point here is that it's a set of frequencies.
It's a whole set. It's thousands of frequencies, but at a certain all at a certain amplitude, and you can see this. Maybe tomorrow I have an oscilloscope, a little oscilloscope. I can show it to you. His Eigen frequencies, and this we give back to him.
So I was going to ask about the difference from the point of view of the receiver, the difference from the biofeedback module of the version 5. So I see now it's because
Yes,
this
it's
was
very
one
different.
frequency at a time, and now it's a set of frequencies.
It's very different because the biofeedback which we had now was really an informational feedback. It found by the core algorithm a resonant frequency, but it was only one.
Yeah, that's the difference, the big
Frequency
difference.
changing, and it's an informational feedback, whereas this is an energetic feedback.
Oh,
An
there's no
electric
information involved here.
Noise information is no informational
Oh.
feedback. There's not even a software. You see,
I
there's
see.
no software.
Okay, yeah.
This thing works, and that's why I'm so enthusiastic about this, because physicists will
This is not
understand-
connected with the core.
No, it's not.
It's only the
connected.
machine.
Only the machine.
Oh, I see.
See,
Yes.
you can use the health integrator, or you can use the health navigator. It's the same thing. But in this case, they are only amplifying.
I see. Yes.
And they are not doing anything but amplifying his own frequencies. So you can, and that's the amazing thing, this is the health integrator and the health navigator. You can give it back either like what we do now electrically, or you can give it back with the magnetic applicators, or you can give it back with the LED pads, or we have here even a laser output. See, this is a laser output here. You can apply this with an acupuncture probe giving laser feedback. I mean, this is the most complete energetic system. And the most amazing thing is here that we give treatment with the own frequencies. And this is a completely different experience. So, do you feel already something? A lot of things. He feels a lot of things. And you see, it's a place where you don't want to discuss. You don't want to analyze. You just want to have. It's like when you are as a child. How do you do this? You are under a blanket, yes, and you try to make your own cave. Who's doing this when you are like an adult? No, almost nobody. But that's a very good Eigen-resonance phenomena, because then you smell your own smell. You breathe your own breath. Every person should do this 5 minutes every day. And especially if you're sick, you should do it. But nobody has ever prescribed this to anyone, because we don't know this concept. And now, when you do this, like Kiran, you can sit on the floor in front of 30 people, no problem. You feel very confident, and wherever you are, you feel confident, and just because what? There's the world, but here is me. See, that's it. But you lose this eigen frequency, this eigen resonance over time, because starting with your mother, tapping on your finger when you have your finger in the nose, or you have your thumb in your mouth, this starts to break the whole thing about eigen resonance. And now here we have really, this is fantastic. I mean, I know this will be the totally changing how we see, not only that's the best thing, how we see healing tools, but also how we see the whole life, because this tells us what is missing in our life. We don't do really what our heart is calling for. So this was the question, this was my question, how do you do this? How do you do what is calling, what your heart is calling for? Because first of all, we don't know, because we don't know ourselves. We know only what other people tell us, what our culture tells us. And then even if we know, we cannot do it because everybody tells us if you do what you want, you will be out. You will be out very soon. And exactly, we don't even have to be a revolutionary. We don't have to do crazy things to show how unique we are, or how special we are connected with ourselves. You can do this now here, energetically. And it takes 10-15 minutes, and then not only do you have a very good sensation of yourself, thoughts come into your mind that know what you have to change, and you will even listen to your heart. You feel your heart. In the beginning, people don't even know where their heart is, right, left, or what. After 10-15 minutes, they feel it. You feel it. And you can even make it audible with you can plug in like a cable to the software, and the software can record these frequencies, and when you have time, I can let you hear a recording of my heartbeat. It's amazing, because it's not the stethoscope, it's not the audio stethoscope, it's the energetic resonant heartbeat. So it's a new phenomenon. So, and this is what I call the homeopathic mode, because we have two modes. We have an allopathic mode and the homeopathic mode. The allopathic mode I talk tomorrow, it's another amazing thing, but the homeopathic is just feeding back your own frequencies. See, and so much about this, and we'll let you can stay, and whenever you feel it's enough, or whenever you want to say something, you say. But it's good to let people just experience themselves, because you will see when you do this yourself, if then the therapist asks you a question, you want to almost hit him, because he's invading my privacy, because I'm now connected to myself. I'm feeling myself. See, and this is exactly what we have totally unlearned in our whole evolution. We have unlearned to feel ourselves. Okay, wait. We turn this down, because if you don't, there might be some little bit. So we turn this down, now you take it out. And anything that comes to your mind, anything that you felt, or that, anything?
I can comment if you want.
Yes, sure.
It's a very interesting say, delimitation. Your body will be so clear. You will have a very nice contour of your body. And after that, you can stay inside. No, not outside.
Good, thank you. You just take your seat, and you see, because this is really very delicate. It's very interesting. You get exactly what you get after like 3 weeks of Vipassana meditation, where you get it in